it was just a complete knowing and trusting in myself. I just knew I was never going to thrive and I could never make the difference and the impact that I know I'm here to do in that place. We have not improved the overall outcome and mortality rate with cancer greater than 20% since the war on cancer started in 1950. We have to do something different.
Welcome to Vet Life Reimagined. Imagine creating your own practice, becoming a trailblazer in your field, and redefining the standard of care for veterinary patients. That's exactly what Dr. Kendra Pope is achieving. Hailing from New Jersey, she's not only one of the handfuls of veterinary oncologists in the United States, but she's one of the fewer professionals also deeply trained in holistic approaches like acupuncture and herbal medicine. With these unique tools in her arsenal, Dr. Pope is all about crafting the best outcomes and quality of life for every patient she touches. Dr. Pope's involvement in clinical research, multiple leadership roles, and volunteer work showcase her dedication to pushing the boundaries of veterinary integrative medicine. She leads her own clinical practice called Prism Integrative Veterinary Health. This episode has One Health, the human-animal bond, finding a bigger purpose, breakthrough options for cancer treatments, and much more. So let's get to the conversation with Dr. Kendra Pope. I start all conversations at our very beginning. So when did you know you wanted to get into veterinary medicine?
I wonder if you get the same answer for that question most of the time. And I mean, the answer is always. I was always going to be a veterinarian.
Yes,
Forever
more often than not, yes, it is a common theme in our profession. I think we're kind of unique that way.
Yeah.
But one thing that does change, though, is while we always kind of had this idea that we were going to go into veterinary medicine, exactly what that might look like does seem to change over time. So did you kind of going into vet school, did you have an idea of what that would be? And did that change?
Oh my God, I did. I was like, I'm going to be a surgeon. I was like, yep, I'm going to be a surgeon. I'm going to, do all the surgery things. And I got to vet school and I hated it so much. So it did change. But I also, to be honest, being an oncologist was always within me from losing my father at a young age to cancer. And so it was just more of accepting that that was my purpose and my mission. And that's the path that I needed to go down. I remember when I told my mom I had finally decided that I was going to be an oncologist, she just got this look on her face and she started crying. And she was like, why can't you just play with puppies and kittens all day?
Oh,
and I'm like, well, first of all, that wouldn't be my life anyways. I'm not going to professional doggy daycare, training, but I always knew within me that making a difference in the space of oncology was where I was meant to be. So although I told myself when I got to vet school that it was going to be different, I found my way back to it.
Yeah. Now, you were extremely active in vet school. It looked like you were part of the student AVMA, and also part of what you do is more on the holistic side. And so did that also start in vet school, or when did that interest kind of come in as well?
I think these conversations are really fun because, there's those moments in life that you have where you kind of pause and you turn around behind you and you're like, oh my God, that's why that happened. Or holy crap, that's why that thing that I thought was so terrible worked out the way that it did. So I could end up where I am now. And I definitely fell down the rabbit hole of other things in vet school. I was at the University of Florida, and that's one of, in my opinion, the most accepting of integrative medicine because they have such a huge curriculum for it. But even in my choice to go to Florida, I feel like there was things pushing me in that direction because what I was able to do while I was there was actually get certified in acupuncture, certified in Chinese herbs, certified in Chinese food therapy, certified in other types of Chinese practices while I was still going to vet school. So I was able to add that to my regular curriculum. So I just learned it alongside the rest of what, we were learning as vet school students. So it just was really, normal to me. It wasn't like it was this whole different thing. It was just all of the tools that we were learning. But what first happened that led me down this path was I developed chest pains my second year in vet school, which, as you'll remember, is the year that we have a million tests and all abnormals, and it's very stressful. And, I went to the physician. They, ran a bunch of diagnostics. They said, it's just stress. They said, here's your anti-anxiety medication. And so I took the anti-anxiety medication and I promptly fell asleep. And then I woke up and was more stressed because I lost all that time studying. And around the same time, we had an acupuncture wet lab, and they were doing a demo. They were showing how acupuncture works. The dog was getting really relaxed, falling asleep. And they were just talking about all of the stress management and anti-anxiety benefits of acupuncture. And so as a diligent little vet school student, I went online and I looked up what kind of published papers were available for helping, chest pain, angina with acupuncture. And there were so many. And so I found a local acupuncturist. I went for my first treatment. And with that first treatment, it was gone. And as long as I went consistently, they never came back. And till this day, I still go. And if I fall off the wagon and I forget to go, they'll come back. So that was my first real personal experience of how these tools are there and are effective and are powerful and can actually be better than the conventional ones in a lot of cases. And that they just need to be discovered and figured out what works for you.
Oh, wow. That is fascinating. And I do love that opportunity of exploring different types of studies, especially while you're going through vet school, because it's such a curious time where you're so open to learning and just being able to have those resources around you, I think is so important. So I'm glad that you got that. And so you ended up, of course, you had your internship and then went into your oncology residency. So do you just remember anything special from going through your residency that maybe kind of back to your reflecting back on, why things kind of fall into place? Anything special that you remember about your residency that kind of impacted you going forward?
A good question. I think that everybody in their residencies, you're disciples of your mentors, and so I think that there's all kinds of isms, from the people who trained me that I still hear in my head and has kind of shaped how I practice clinically, because even though even me in my integrative and holistic practice, we all try to practice evidence-based, evidence-informed when the evidence isn't there, that we still take our clinical experience into account. It absolutely shapes how we practice. And so I think that, just some of the isms of the residency, I think, the other thing I think is really fun about a residency is, you go from being a student where people are always looking over you and you kind of, that you'll do that too as a resident, but at the same time, it's like they let go of the reins. And I just remember looking around the room and being like, I need a more adultier adult. I don't want to be the most adulty adult at this point. But at some point you just get kicked out of the nest and you have to fly. And, I think that that's my personality. I've always been someone that's just kind of let me figure it out. And so I think that even though it was scary at times, because they're there if you really screw something up, that I was just like, all right, let me figure this out. I got to get it done.
Were your mentors also very, did they practice a lot of the alternative medicine as well? Or did you find other types of mentorship?
My residency was completely conventional. And so, during that time while I was in my residency, I was actually working at a private practice hospital on Saturdays. And at that point, I was just doing acupuncture and Chinese herbs just to keep myself in practice and to be remembering those things. But I really kept everything completely separate. There was Kendra, the acupuncturist, and then there's Kendra, the oncology resident, until I finished, because, residencies are intense. That's your primary job. And so that's what I did. It was my primary focus. But once I completed the residency, went to work in private practice, that's when I really got to take both hats, put them on at the same time and kind of bring it all together.
How was that journey? Because there can be some stark divisions
Yes.
between this, very traditional clinical practice and using those integrative approaches. So how was that transition, kind of
Yeah.
finding the Kendra method
Oh my
going
gosh.
in
Yeah.
forward?
I think that there's so many things about early employment and your first job that are so beneficial, not just to find out what you like, but to find out what you don't like.
Mm.
And I found out pretty quickly that the typical paradigm of volume-based medicine didn't work for my clients and the way that I wanted to practice, because so much of what is done in the integrative and holistic space is about the intellectual property and the time that you spend talking to someone and educating them. And when we think of conventional veterinary medicine, conventional oncology, it's about the procedures, it's about the treatments that we're doing. That's where the finances are based. And so it was a real challenge for me because the corporation that I worked for had certain financial expectations that they wanted me to be able to operate my holistic practice the same way I operated my conventional practice. And it just didn't work that way. And so, as someone who did a nutrition residency, that's a huge intellectual property specialty. So you'll know exactly what I'm talking about.
Yeah.
It's not in our treatments and our procedures, it's in what we share and the plans that we develop and the treatments that we develop, and pulling everything together and personalizing it for the patients in front of us. So it was not easy. I found that I was split often. I found that I needed to see clients that had no interest in what I was doing, but that were coming into the service just for the conventional. And so I was really torn into, having to be two separate practitioners in one. And it absolutely did not work. And despite the fact that I learned a lot and was grateful for a lot of things in that first job, it's what prompted me to start my own business, because I knew that in order to be truly effective and to really be able to make a difference, I was going to have to do it the way that I knew would work better.
Yeah. It's one thing to realize that moment. And then I guess the next one is, okay, now I got to do it.
Yeah.
So
Yeah.
what was that like? You
Yeah.
realize that, okay, to really be true to myself and to do what I feel like I'm supposed to do, I'm going to have to kind of do a lot of this on my own. So,
Yeah.
so what was that process like?
I wish that I could, well, I don't actually wish because it's my story and I love it. But, sometimes I'm like, do people expect me to say I made a business plan and had all this strategy and all this planning and all this sensible stuff? For me, it was just a complete knowing and trusting in myself. And I just needed to get out. And I knew if I didn't, I would die there, figuratively. Like I just knew I was never going to thrive. And I could never make the difference and the impact that I know I'm here to do in that place. And so I gave my boss 5 weeks notice. I had no business plan. I had nothing in my savings account. It was abysmal. And because I'd only been working for a few years, and I just found this little tiny space that was 10 miles away. And I opened a practice. And very quickly, it became very obvious to me how much of a need there was for exactly what I wanted to be doing and how impactful and important it is and how much of a difference it made. And the rest just took care of itself. I mean, it's not without stress, and it's been the hardest thing I have ever done. But we'll celebrate 6 years next month. And we have moved to a brand new facility. I have hired another doctor. We have consulting doctors. We have over 1,000 clients, over 1,200 patients. And so it's just been an amazing journey. And it's just been a reinforcement that it was the right thing to do.
Yeah. Well, and you use the term we. So I do firmly believe that when we find the best success is when we do it with others.
Yeah.
So did you find mentors or people who you got what you the vision?
Yeah.
How did you kind of collect your we?
Oh my gosh, I completely agree with you. The we makes or breaks it. And I think that the we changes because we had a huge shift in staff when we moved to the new building. And it's not because there was bad blood or did anything wrong or anything like that. What I think just happened is the we that got me to the new building wasn't the we that was going to take me to the next chapter. I think it was just that group of women who at that time it was all women, and it was still all women until just recently I made my first male hire, were meant to kind of carry me to that place and then move on. And, I think that, to be honest with you, that has been the hardest part, is finding the mentors, finding the team, because I do think that people are meant for seasons and chapters and not always meant for every part. And so it's a lot of reinventing and finding new people. Like in the beginning, I really consulted with conventional veterinary business owners and mentors, and they were really helpful in the logistics. But then the business got to a point where it was too different, and what they were advising me just wasn't what I needed. So then, I reached to human side, human integrative practices and what that liked. But then that gets to a point where they also aren't exactly right. So it's kind of been like this amalgamation of a little bit of you, a little bit of that, like putting it all together, throw some special sauce in. and 6 months, 12 months, 5 years from now, it'll probably all be different again. So that's been the hardest part for me, because I like consistency. I like to know what is going to play out so that I can plan. But being a business owner has taught me that you have to throw all of that out the window.
or at least willing to accept that things are going to change.
Yes, and exactly. It's just part of it.
Yeah. Well, and I think that can be the beautiful part of it too. And I think being in this profession, and especially like with oncology, and yes, I absolutely can relate from a nutrition perspective as well. Each patient, each family that comes with the patient are all going to have different needs. And so I definitely hear as we are changing with technology and all sorts of things, the one thing that will always be needed is that human element. And it was definitely something that I could tell in my oncology rotations. There is something special about, oncology. And it is because you really get to know very vulnerable parts of people.
Yeah.
Working with these families who are, just adore their pets, and you become part of their family. So can you speak to that too? Because I think that is something I would be remiss if I did not get to talk to you a little bit about working with pets and pet families like for you.
Yeah. Yeah, I think exactly what you're saying. It's just about how high touch it is, like I think in other specialties, like let me bring up surgery again, because that was like what I thought I was going to do originally. And ultimately why I decided it wasn't right for me is like that quick gratification, and those like quick relationships on one hand are great, right? Because they get to do this exciting stuff and fix stuff all the time. But for me, that more slow burn and long-term relationship is something that I knew I was really good at, and that I had a way to connect with people and help them through something that's really difficult. And I think that, internal medicine specialists, oncologists, nutritionists, we're with these patients usually for the rest of their lives, similarly to how, a lot of general practitioners are, right? They meet them as puppies and they have them till they euthanize them. And so those long-term relationships, some people, that's their calling, is to be there for those people at that time. And although some people might say, oh, how can you do this all the time? And, isn't this so sad? And I don't understand how anybody could deal with this day in and day out. I think most oncologists will tell you it's not that way at all, because we're the ones that are able to offer something to help them. It would be one thing if we were the ones that were just delivering the bad news and saying that there was no options. That would be horrible to do all the time. But when you're the person that gets to tell them, yes, there is this bad news, but let me tell you about all the things that we can try to make it better. I mean, that's a completely empowering place to be. And so I think that another reason that I have been so drawn to the integrative and holistic space, and that I feel so grateful to be here, is because I get to say that even more now than I did when I just had my conventional tools. I mean, it is hard. I was just having this conversation with an oncologist that's getting into the integrative space. And I said to her, you're never going to regret this decision, because I promise you that there will be almost no patients that you will have to say, I can't do anything. There's nothing else that I can do, because there's always going to be something that you can try to help them. And so it's a lot of pressure though, and it's a lot of responsibility. And so the other side of it is you get to be so lucky and so grateful to be in that position, but you also have to understand that every client, every day is completely emotionally out of control. And so it does have to have a lot of boundaries, which sometimes people understand and sometimes people don't understand. But in order for me to do this for the rest of my life and to continue to make the impact that I'm here to make, that's what you have to do so that you can show up 100%. That means that, there's only certain days of the week I see patients. That means you don't get my cell phone number. That means you can't email me. That means when I'm not in the office, you have to leave a message. And that can be really hard for some people. But that's when you give that much to someone, you have to have that kind of door that closes sometimes.
Yeah. So my dad is a child psychiatrist, and I've been going to work with him. I promise there's a point here. I've been going to his work with him since I was an infant. And it just always amazed me how good he is at his job and how good he was at being a dad. Like, he came home and he was dad. And, especially as I've gotten older, I would ask him, I'm like, how do you do this, Dad? Like, you see some of the worst kind of cases.
Yeah.
How are you able to do this every day? And he did. He said he basically has to check it at the door.
Yeah.
And I think some people are really good at that, like my dad. And then there's some where it's a little bit harder. But, I think I see that across the veterinary profession is that people keep reminding us about boundaries, and we care about what we do. We really care about our patients. We do have these relationships. We get to know our clients for a long time. So how were you able to do this? What are your tips for kind of founding your boundaries? You mentioned, like, don't give out your cell phone number and all those kind of things. But, no, number one, but what are some other ways that you have found that you can really embrace, be the best you at work, but then also be able to leave at the end of the day and come back the next day?
It's really hard, and I'm not going to act like I have it figured out for sure, because I feel like it's a work in progress every day. And I feel like I've gotten a lot better at it recently, but especially wearing the hat of the business owner and then wearing the hat of the, one of the doctors, it can be really challenging. I would say that what recently I've just been doing a lot of is going back to thinking to myself, like, at the end of the day, when I'm laying on my deathbed, will this matter? When you're afraid of what a client's going to think about you, or you're afraid of getting a bad review, or, a client's upset because they can't get an appointment, or, any of those things that happen to us in the day that make us give in and don't hold those strong boundaries. It just comes back to what your priorities are. Like, is this going to matter at the end of the day? Because I think that we're all here for such a short time. It's just like a blink of the eye. Like, I can't even imagine. It's been almost 15 years since I graduated vet school, and I just can't even believe that already. How did that happen? Time just goes so fast. And I feel like there's so many things that I want to be able to say that I've done, that staying really focused, laser focused on what those priorities are, doesn't make it easy, but kind of allows those other things to slip into the background, because it just doesn't matter at the end of the day.
I think that's a very good point. Now, I love trying to find what our why is, because that's the heart of what we do. It's not necessarily what, it's the why we do what we do. So, I asked you also earlier what you were passionate about. And I think that is so neat that someone is dedicating effort to get some more data behind the integrative approach, because I think we are trained to do that. We're scientists. We like data. We like proof or something that we can use. And oh goodness, now that I'm thinking about it, oncology, we're kind of limited in the information we even have on the traditional side,
right?
But then also on the integrative side too, there's only so much information, especially with the species we're working with. So I would love for you to share a little bit more about how you saw this was important and what you are doing currently on, trying to get some more data despite some of the challenges.
Yeah. I am always happy to talk about this because I think that it's a piece of education, which I always am happy to do because it's just something to me that's so important. So in losing my father to cancer when I was 22, it was a very short battle that there was tons of suffering. And during that time, I just remember feeling so helpless because at that point, I was an undergrad. I actually had just finished college. I was a biology major. So I knew enough about science and genetics to understand a lot, but I didn't know anything about medicine at that point to be able to help him. And once I fell down the rabbit hole in vet school of holistic and integrative modalities, I just had this total aha moment. And I think that I know it was in my sophomore year of vet school. And I think it was in like pharmacology class when I was like daydreaming. And I just had this total aha of, oh my God, if you put together these treatments for an oncology patient, their quality of life will be so much better. And I immediately found all of these things that back that up. Tons of research papers, tons of articles, so much in the traditional practices, because these modalities had been used for thousands and thousands and thousands of years alone before traditional chemotherapy came up. And then we forgot about all of them when the advent of antibiotics and conventional medication and chemotherapy came up. But if you look at traditional cultures, specifically like Chinese cultures and Indian cultures, where these old herbal traditions run deep, they do not allow patients to go through these toxic treatments without support. And so the more and more I learned, the more and more it blew my mind that we had forgotten about all of these things that were so helpful for so long. And as I learned more and understood the politics more and researched more, you realize why that happens. And it's because these trials are very expensive and they need to be funded. They don't just come out of nowhere. They need to be done by people. They need to be created, the statistics, everything. And so generally speaking, that financing comes from a company that has a vested interest in the research, which usually is a pharmaceutical. And so when we're talking about non-patentable natural products, there's no money in that. And so it requires an outside of the box thinking, just like all my patients do. They need that outside of the box thinking to think about all of the other tools that we can use for them. And so it was just a natural thing for me to be thinking of other solutions than already exist. And I'm a very conventionally trained doctor. I had a very conventional residency. Just because I believe in all this other stuff doesn't mean I've forgotten about all of that. And so for me, and in my experience, the best integrative and holistic mentors have always been the ones that have approached those non-traditional therapies with tons of questioning and tons of reservation, because that's how you really figure out the truth to all of it. And that's how I approach everything. You need to prove this to me, prove this to me, prove this to me. And the further down the rabbit hole I went, the more I found and the more I knew how much is there if it could be spoken in the correct language. And so one of the biggest hurdles for a lot of these modalities is the people who are practicing them are speaking them in the language of that tradition. And when we talk about our conventional trained doctors and our specialists, they're like, what are you talking about? That makes no sense to me. So when you have someone who's bilingual and they can use that traditional language with the traditionalists and they can use the science with the conventionalists, you're talking about the same thing. You're just speaking different languages. And so it became obvious to me that it's not about them or us. We're all doing and want the same thing. We just can't communicate with one another. And so the language of communication for our scientific community, for the funding, is in the conventional research and in the data. And so the beautiful part for me, and the reason this is my why and this is my mission, is that animals are spontaneous models of cancer that are like canaries in the coal mine. They get cancer rates at the same, if not higher, than people do. They get the same ones in our same environments. And they act very similarly to they do in people. And so instead of us going around trying to make a difference in human cancer treatments by studying lab rats and mice that are injected with tumor cells, we need to look at these dogs and cats that get them in our environments. And why not allow these research experiments, these projects that show that they're effective, show that they're safe, show that they prove efficacy to quality of life and quantity of life, to serve as foundations for it to be done in people too. Because at the end of the day, that bond that we have with these dogs and these cats or horses or whatever kind of person you are and what animal you're bonded to, that bond is so powerful. It will allow us to do anything for the loved ones that we have. And that's why, as veterinarians, we do what we do. And I can feel like my eyes welling up because it's just so profound, that love that we have for them. And so why not allow that love and that bond and that mission that we're here for also make all of our lives better too?
Oh, wow. And this is not so warm and fuzzy, but back to the funding part is that when you can tie it to a human problem as well, you might be able to get more funding for
Absolutely.
it. And so not only are you helping across the board, but you might also be able to get that funding for it as well, which you're right. I think earlier you made the example about, on the nutrition side, a lot of times the funding is coming from a big pet food companies because it is expensive. And, somebody's going to have something in the game to be able to put forth the money. So I think that is spot on. So what are some of the examples of work that you're doing, or maybe some of these people that you've met who are maybe jumping in and some of the different cancers maybe that you're helping? Any stories? Stories are helpful.
Yeah, we have filed for official nonprofit status. And so in the near future, I hope to have many more of these trials now that we have a nonprofit that can receive grants and funding. But in the meantime, we've been creating a few projects, and I've worked on a few that I would love to share because it just shows how really honestly easy these things are to do. So there's a urban supplement company that is on the human side, and the founder of the company is very well known for treating cancer. He's done it a very, very, very long time, and he's gotten so much success, but he hasn't been able to get anything published. And so we approached each other because we knew that there would be a mutual benefit. So the trial that we're putting together with his company is specifically for dogs with lymphoma, because the type of lymphoma that's most common in dogs is a kind that's very similar to people, the type that young people actually get. And the chemotherapy protocol is exactly the same, with the exception of one drug that they have in humans that we have not found useful in animals. And really, that's the standard of care. And in veterinary oncology, we have not made any advances in that in, I think, like 25 years or something. So it is taking this herbal protocol that he has, and it's going to be clients that have declined chemotherapy, and they're all going to be allowed to get steroids because we know the survival time and the effectiveness of that. But one group will get placebo and the other group will get this herbal protocol. And so what we're going to do is we're going to monitor, obviously, the response of their lymph nodes to the prednisone and the placebo or the herbal protocol, their quality of life, but then also their quantity of life, because we know how long they're expected to live if we just treat them with steroids. So we can compare that to how long they live when they're also treated with this herbal protocol. Because despite the fact that we know the chemotherapy works, it's not always right for everybody. Sometimes people can't afford it. Sometimes the pet is too sick and the side effects are not tolerable. Sometimes the client just really knows that it's not the right thing to do for their animal. If they're very high stress or coming to the veterinarian, it's very bad for them, or if they're highly aggressive. Those are all reasons that clients have declined it in the past for me. So if we prove, which I feel strongly that we will, that there's benefit, it's going to be another tool in our toolbox that we have to offer these people.
One of the things that when I try to explain the difference of cancer in people and then the cancer in pets, is that often the end goals or the main main goals could be slightly different. So for
Yeah.
people, it is we are trying to get life, like length of life, and a lot of times that doesn't look so good to get there. But then with
Yep.
pets, we're thinking a lot around quality of life instead of quantity. Has that come up at all when you're trying to sometimes pair these treatment plans when it comes to pets and people?
I think that there's always a lot of education about what the goals are. And I think what I feel most grateful for is that I am a veterinary oncologist and not a human oncologist, because the reality of the situation is that you don't get to prioritize quality of life. That's not what you're prioritizing. It's just like what you said. It's about quantity or bust, regardless of what that quality will look like. And the very sad reality is, I often wonder, my father included, if you could fast forward to the end and you would say, you're only going to get 8 months and it's going to be shit the whole time, versus, you getting 6 months or maybe more, who knows, with no treatment, which would you pick? And most people, if they could see into the future, would pick not to, because who would choose that? The problem is that we can't see into the future. And so what I'm so grateful for is that we get to have those conversations, that we only move forward if the quality is there. If the quality goes away, we stop. And that's something that most oncologists are on the same page about. There's a lot of us that are willing to be aggressive if we think that it's the right choice, and we will be, and it will be worth it. But we always get to prioritize quality. But the thing about bringing in the integrative aspect and the holistic aspect is that is always the primary, and you don't have to worry about the other one. You don't have to worry about sacrificing quality of life to get quantity. That's just what it is the best at doing. And so this shift in pain and in clients shifting their target goal from cure or from quantity to quality is an education piece, because that's conventionally what we understand and we believe. But the reality of the situation, and in my experience after doing this for many years now, is that oftentimes if you do pull away that shift from cure at all costs to quality of life, they often will live longer. Their cancer is not going to be gone. Their cancer is not going to go away. Their cancer may continue to progress. But because you're able to mitigate the GI symptoms, the lethargy, the inflammation, the immune system dysfunction, they often can live longer with disseminated cancer. And so it's allowing them to focus on their pet just in front of them versus the imaging studies, the diagnostics tests, the blood work results. And so that's the part that I think is really challenging for all of us to kind of appreciate.
As you're talking about this, I'm reflecting back even from personal example. We've had one recently, but I listen to a lot of podcasts, and so these stories come up on these podcasts about they got the cancer diagnosis, and their doctor at the time gives pretty grim, outcomes, and they focus mainly on chemotherapy options, but maybe that extra tool belt that you get to bring with the integrative approach. A lot of these people, they heard that from one doctor, but then they're like, let's go. What else do we have? And they find people with more options, and a lot of times they do well. And then our personal example, my husband's very close friend, he got diagnosed with cancer. They tried chemo, and it was miserable. He was not doing well, both I think just from feeling terrible, but also it wasn't combating. And the way they described it was, he kind of gave up. And I think when you are able to address the quality part of life, it's like it gives them that extra fight to conquer, I think, what they're dealing with. And so I think this is such a huge, huge thing that you are doing. And the fact, like you said, that there's that crossover, that we're able to help with the human medicine as well. Yay, One Health.
Yeah.
Bringing that in. That's fantastic. Have you been able, since you are, partnering with the human health side, have you gotten to talk with the human patients as well, or do you just kind of meet and cross notes? How does that work?
I have not done much with the human patients yet. I think that probably for all of time, that'll just be something that's really hard for me, my personal loss. But I get to talk with the human practitioners all the time. And I go to all the human conferences now because, at one point I kind of was like, all right, well, this is all the veterinary conferences that have the integrative stuff. So it's time to move on to the human ones because there's none left that, are kind of fulfilling all my interests that I have in different things. And they just think it's the coolest thing because a lot of them are pet parents and,
Mm-hmm.
dog and cat moms. And as integrative and functional medicine practitioners themselves, they know all these tools exist. And they're like, well, why don't they exist for my dogs? Why don't they exist for my cats? Why don't they exist for my horses? They also think it's really cool because if you're an animal lover, you're an animal lover and you know about that bond and you know how powerful it is and you know how much it can help do so many things. And so when I've met people, he used to be the head of Memorial Sloan Kettering's Integrative Center, and I believe he's at Dana-Farber now. I met him in my residency when I was at Penn because he was at Penn's Integrative Center at that time. And I shadowed him on one of my wild card months that I had to shadow, whatever facility I wanted. And when I told him that I was doing this acupuncture trial for dogs that had lymphoma, and this was an older one, not the one I was just talking about, he just got so excited because he had been trying to get funding for his acupuncture trial for people with cancer for years and he couldn't get anything. And he was like, if I could show them this paper, if I could show them this research, I can do so much more good for humans. So I think that the human practitioners really get it, and they know that they have these tools available for people and they love their animals and they want to see the same thing. And the very sad reality is that the cancer rates are skyrocketing. They're skyrocketing in humans under 50. The most recent, it wasn't a published paper, but it was a huge survey study that was done on 20,000 dogs? It was a lot of dogs. And we found that the incident rates is 5 times that in people now. So it's skyrocketing in animals. And I'm not even going to get into what I think is going on and why it's happening. But the reality of the situation is that this is a huge problem and that they anticipate by, I think it's 2030, 50% of all humans will actively be cancering. 50% of all of us will just actively have cancer. That's how bad they anticipate it's going to be. And so for us to continue to do the same things that we've always done, which is not giving us the results that we need, we have not improved the overall outcome and mortality rate with cancer greater than 20% since the war on cancer started in 1950, and that 20% is believed to be due to us finally understanding that smoking's bad.
Wow.
So we have done nothing to shift the needle. We have to do something different.
I'm so excited that you are. And if there are people who are who want to refer someone to you, like a pet parent, to find these alternative treatments, or maybe they want to learn more about what you do and to learn more of these techniques, where could they go?
So the time has come that we are finally doing education. We are launching online communities because there's just such a need for this. And even, there's a lot of veterinarians who are interested in this too, but as you can imagine, you're going to devote your life to this, right? And that's not everybody's goal. And so being able to help patients far and wide, even that maybe can't access a practitioner locally, is something that the practice and knows we need to do and is part of my mission. So for our veterinary practice, the name is Prism Integrative Veterinary Health. So we're in New Jersey right now. You can follow us online. You can refer to us there, but you absolutely can follow me on social, Dr. Kendra Pope on Instagram, on Facebook. We are starting our first kind of beta cohort of veterinarians this fall for an integrative oncology course. And I hope that becomes something that we do annually to really just train veterinarians how to handle these guys in a really evidence-informed, effective, high-level tailored way. And then we hope probably by October or November, we're going to create an online pet parent community so that we can just be educating and allowing them to know about what's safe, what's okay, what they should know more about, what maybe they shouldn't be doing more of, and just allow people to access information that's really collaborative with their veterinarian. Because we don't want to create this like, my vet said no, so I'm doing it anyways. We want to lean into one another. So we want to create this environment and this community where we can just help empower people to have better conversations and better relationships with their veterinarians.
Well, that sounds awfully like nutrition as well. So,
Yeah.
going off a certain direction. So, well, thank you so much for what you do. I know we're at time. Can I ask you at least one question?
Yeah.
To wrap us up.
Yeah.
So, what is something that you are most grateful for?
Oh, God. I'm going to get emotional, which is fine because this stuff is so important. Despite the fact that I was such a daddy's girl and I hate losing my father, if it wasn't for him, I would never be on this path. Like, it's all because of that love. And so I'm grateful that even though that had to happen, that now I get to like pour that into something else. And I know I'm going to leave the world a better place than I found it because of it.
This has been the Vet Life Reimagined podcast. Whether you are listening or watching on YouTube, I hope you enjoyed this conversation. Please make sure you are subscribed to catch all these amazing people in our profession. Also, send this episode to someone you think who would appreciate it. Have a recommendation for someone who would be a good guest? Please reach out on LinkedIn, Instagram, or Facebook. There aren't that many Dr. Sprinkles. Until next time, Vet Lifers.